Welcome all. Today in this class, we are going to discuss about Paithiki yoni vyapath. So, what is Paithiki? Yada swaya dushane dushtam pittam yoni samasridam karodi daha pakosha pudi gandha jwaranidam prishoshna bhuri kunaba neela pita asidartavam sa vyapath Paithiki. So, Paithiki is a pitta pradhana yoni vyapath. So, the factors responsible for the vitiation of pitta when get manifested at the yoni, we can see that this is Paithiki. Ida swaya dushane dushtam pittam yoni samashridam. Then what are the symptoms of Paithiki yoni vyapath? The symptoms are daha, pudigandha, jwara, kunaba artava, krishoshna kunaba srava. Daha means burning sensation can be seen in a lady with Paithiki yoni vyapath. There may be purulent or copious vaginal discharge. Then she may be affected with a fever. Then there may be irregular or excessive vaginal bleeding can be seen. Then abnormal vaginal discharges are seen. So the main features of the Paithiki yoni vyapath is like that of an acute inflammatory condition of the pelvic area. That is purulent or copious discharge with the fever. All the inflammatory conditions we can see. Purulent or copious discharge, fever, abnormal vaginal discharge, burning sensation. So the Pitta Pradhana Lakshanas we can see here at the Yoni Sthana. So again the sloga is like that. Daha Paka Osha Pudi Gandha Jwaranidam Prishoshna Puri Kunaba Neela Pita Asidartavam Sa Vyapath Paithiki. Again the different colors of menstrual blood. We can see different colors in the menstrual blood. That is Kunaba Neela Pita Asidartavam can be seen. Sushruta Acharya said that Pittala, Yoni, Daha, Paga, Jwaranida. Almost same symptoms are described by Sushruta Acharya. Charaka Acharya has also mentioned about this disease. Almost same Lakshanas are seen. So the clinical features is almost similar to the acute pelvic inflammatory disease. So what is PID? PID, it is a spectrum of infection and inflammation of the upper genital tract organs, typically involving the uterus, this endometrium, fallopian tube, ovaries, pelvic peritoneum, and the surrounding structures. That is PID, pelvic inflammatory disease, means it is the upper genital organs. In this disease, only the upper genital organs is involved, not the lower genital organs. So the vagina and the cervix are excluded here. Only the upper genital organs, that is uterus, fallopian tube, ovaries, pelvic peritoneum, and the surrounding structures. If there is any infection there, it produces inflammation of the upper genital tract and we called it as a pelvic inflammatory disease condition. So the symptoms of this PID are, we can see pelvic pain here, adnexal tenderness, almost similar to the symptoms of Paithiki yoni vyapath. Pain is there, adnexal tenderness. Then fever, we can see both in the Paithiki. Fever, headache, lassitude. Then abnormal vaginal discharge, purulent and copious. It is almost same to the Lakshanas of Paithiki yoni vyapath. Then irregular or excessive vaginal discharge can be seen. Dyspareunia, that is painful coitus. Then Fitz-Hugh-Curtis syndrome. It is a symptom that is pain and discomfort in the right hypochondrium due to concomitant perihepatitis. So these are the clinical features of pelvic inflammatory disease. These clinical features are almost similar to the Paithiki yoni vyapath. So when a lady comes to our OP with these conditions, we can diagnose with these clinical features, we can diagnose it as Paithiki yoni vyapath. So the clinical features of PID are pelvic pain, adnexal tenderness, fever, lassitude, then abnormal vaginal discharge. There may be irregular and excessive vaginal discharge, then dyspareunia. So in this PID, it is associated with the ascending spread of the microorganisms from the vagina and cervix to the endometrium. It is an ascending infection. That is, once there is a vaginitis or cervicitis, it is inflammation and infection of the lower genital tract, it gets ascended to the upper genital organs. And get manifested as the pelvic inflammatory disease. There is infection and inflammation of the uterus, ovary, and even fallopian tube. So the organisms involved mainly are Chlamydia trachomatis, then Neisseria gonorrhea. Less frequently other organisms. The main organisms involved in this infection and inflammation are Chlamydia trachomatis and gonorrhea. But then what are the predisposing factors of this PID? Menstruating teenagers, then multiple sexual partners. They may get infected. And inflammation of the upper genital tracts happen. Then a previous history of acute PID, then IUCD users, intrauterine contraceptive devices. Then in an area where there is a prevalence of STDs, they may be seen many cases with this PID. So the clinical features we have already go through. Then signs. On examination, what are the signs we can see? When we do an abdominal palpation, we can see tenderness on both the quadrants of. Then on vaginal examination, we can see the purulent discharge, then congested external urethral meatus. Pus discharge may be seen in the urethra. Then on bimanual examination, we can see cervical motion tenderness, then bilateral tenderness on the fornix palpation. When we do vaginal examination, these can be seen. That is, on externally, we can see purulent discharge coming through the urethral meatus. Then cervical motion tenderness, the lower genital tract. Then bilateral tenderness on the fornix palpation. These are all can be seen in the vaginal examination. When we do an abdominal examination, we can see tenderness. When we do a specular examination, we can see a congested cervix with the purulent discharge. So almost tenderness and inflammation. The symptoms of, the signs of inflammation, that is, we can see in a patient with this pelvic inflammatory disease. Inflammatory signs like fever, then purulent discharge, then congested urethral meatus, then tenderness, all we can see in this pelvic inflammatory condition. So investigations we done for the identification of organism, that is mainly through the pap smear examination. Then in blood investigations, we can see the elevated leukocytes, elevated erythrocyte sediment, ESR, erythrocyte sedimentation rate. Then on laparoscopic examination, it is the gold standard. On laparoscopic examination, we can see an edematous tube. Then maybe purulent, that is pus discharge can be seen. Then pyosalpinx, that pus in the fallopian tubes. Then maybe pelvic abscess. So the edematous tube, it is mild, moderate, and severe. In only severe cases, we can see pelvic abscess and pus in the fallopian tube. In mild cases, we can see only edematous tube in the laparoscopic examination. When UST is not so much important in the diagnosis of this pelvic inflammatory disease, but on UST, we can see fluid in the pouch of Douglas, and maybe an adnexal mass may be seen in this ultrasound scan. As it is an inflammatory condition, the blood investigation should be done. And for identification of organism, we can use pap smear. Culdocentesis means the fluid from the cul-de-sac, that is the pouch of Douglas, is aspirated for examination. Pouch of Douglas is a pouch seen on the posterior of the uterus. So in acute inflammatory condition of the pelvis, that is pelvic inflammatory disease, what are the treatment? Antibiotic therapy can be done to reduce the microorganisms. Then if needed, surgery. In acute and severe cases, surgery if needed to be done. So when we go through the symptoms and the treatment, Paithiki and acute pelvic inflammatory disease, the symptoms are almost similar. So we have studied about Paithiki, its symptoms, Then pelvic inflammatory disease, its signs and symptoms and treatment. Then what is the treatment of Paithiki in Ayurveda? Pittalana tu yonina sega apyanga pijukriya shitala pittahara karya snehanartha kridanisha. The Paithika treatment should be done in Paithiki. Pittahara treatment should be done in Paithiki. Sega, Apyanga, and Pijukriya can be done. Sega, Abhyanga, Pijukriya. Pittahara, Sega, Apyanga, and Pijukriya can be done. And Shitala Dravya should be used. For Snehana, Krida should be used. As Krida is Pittahara. So Sega can be done with Panchavalkala Kashaya. Then Yoni Purana can be done with Negrodadi Kashaya. Yoni Kalka Dharana, Panchavalkala. Mainly in this Paithika, Panchavalkala drug has an important role as it is Pittahara. For Snehana, Krida can be used as Krida is Pittahara. Then Shitala Dravyas should be used. Sega, Apyanga, and Pijukriya is an important treatment in Paithiki. That is Pittalana, Tuyunina, Sega, Apyanga, Pijukriya. Then some other treatment modalities. Basti can be done with Madhuraushadha or Madhuga Siddha Kashaya. Then internally, we can use Brihat Shadavari Krida, Negrodadi Kwada, Halasarpi. Then Jivaniya Shirasarpi can be used. These are some of the drugs which is Pittahara and Shitala in nature. And in clinical practice, some of the common drugs we are using are Pushyanaga Churna with the Tandalambu, then Tiktagam Kashayam, Chandraprabhavadi, Vilvadi Gulika, Guluchyadi Kashayam, Drakshadi Kashayam. So, thank you all. So, we have studied the signs and symptoms of acute pelvic inflammatory disease. It is similar to the Paithiki Yoni Vyapath explained in our classics. Ashtanga Hridayakara, Susrutacharya and Charakacharya has explained about this Paithiki Yoni Vyapath. Mainly, acute inflammatory condition of pelvis is almost similar to this Paithiki Yoni Vyapath. The treatment should be Pittahara, Shitala. So, thank you.